honestly, for maximum neuroplastic benefit, pairing these sessions with active learning on movement is huge. Having clients perform cross-body movements, mindfulness, or cognitive tasks during treatment, this coupling of stimulation and intentional action is actually enabling your brain to create new neural circuits. This is going to work far more effectively than either of these protocols will alone, and just doing the movement or doing like the tongue stimulation. Hello, everyone, and welcome. I'm Dr. Rob Vanbergen. In this session, we're going to explore how microcurrent therapy can be used to enhance neuroplasticity. This is the brain's ability to recognize itself, reorganize itself, and form new neural pathways to essentially recover from injury or dysfunction. So whether we're addressing trauma or chronic pain or neurological disorders, understanding how to stimulate neuroplastic change is key to helping our clients achieve lasting results. What is it? Well, it is the brain's capacity to adapt and to rewire itself. And for a while, it was something that I think people didn't even know it existed. But it does this in response to experience, to learning, and even to healing stimuli. It occurs at both functional and a structural level. Essentially, neurons will grow new dendrites. They'll strengthen or weaken synapses, and they'll form new connections to optimize communication. Neuroplasticity underlies recovery from strokes, from emotional trauma, from brain injuries, chronic pain, even cognitive decline. But this adaptive ability depends on a healthy cellular function, which is really where microcurrent comes in. Now, microcurrent delivers subsensory electrical currents that mimics the body's natural bioelectric signals. Many of you know this already. These currents work at the cellular level to restore membrane potential, optimizing ATP production, which is fuel for healing and regeneration. They work to increase protein synthesis and improve neurotransmitter balance, and to reduce inflammation and oxidative stress that impairs the neural communication in the brain. Now, by improving cellular energy and improving signaling, microcurrent is creating the ideal physiological environment for neuroplasticity to occur. It is essentially priming the nervous system to learn and to adapt more effectively. Now, there are some key strategies with microcurrent to enhance neuroplasticity. I think first and foremost, you're going to look at frequency pairing for brain optimization. Certain frequencies work better with the brain. It just is the way it is. If you're looking to balance the brain, you're looking at gamma waves, 32 to 45 hertz, somewhere in that realm. You can either be static or you can use a range like we do in our machines. This is going to be great for helping with areas like the cortex and the cerebellum. The vagus nerve is something we work with all the time as well. This can be huge for parasympathetic regulation. Honestly, one of the best protocols for microcurrent is going to be tongue stimulation. This is actually the kind of colloquial term for it. We officially name it cranial nerve stimulation. But you compare these frequencies, these different modes, different protocols to increase learning, to reduce fear, to restore function, right? The amygdala and the hippocampus, this is where your trauma is held. So you can target different areas of the brain by targeting different treatments and ultimately pair those together. Now, another thing you can do is bilateral stimulation. By using the ear clips, for example, you're essentially encouraging cross-hemisphere communication. This technique is kind of mirroring bilateral eye movement therapies, and it helps to integrate like left-right brain function. I think that's a topic for a different video because there's definitely a lot to dive into there. Stimulating the vagus nerve, using the tongue stem on the brain stem, this is all going to be part of this process of creating a neuroplasticity response. And sequencing this follows the body's natural hierarchy of neural activation. So from autonomic regulation to higher cognition. I think that combining this in the end with what you're trying to achieve as far as movement is one of the best things you can do. Honestly, for maximum neuroplastic benefit, pairing these sessions with active learning on movement is huge. Having clients perform cross-body movements, mindfulness, or cognitive tasks during treatment, this coupling of stimulation and intentional action is actually enabling your brain to create new neural circuits. This is going to work far more effectively than either of these protocols will alone, and just doing the movement or doing like the tongue stimulation. So lifestyle factors do weigh in here as well. They always do in everything. But microcurrent accelerates that neuroplastic healing, but sustained change requires ongoing support. Nutrition is important. A sufficient omega-3s, magnesium, antioxidants, these protect neurons. Sleep is super important. Deep sleep consolidates new neural pathways. Mindset is critical too. Encouraging curiosity, allowing gratitude, continuous learning. Mental states in these positions biologically favor neuroplasticity. These things want it. And stress management is important too. Chronic stress floods the brain with cortisol. It blocks new growth. We do need to remove that. Combining the vagus nerve stimulation with breath work and other techniques to help reduce that stress is going to be very important to allowing neuroplasticity to take place. I think neuroplasticity is a topic that we don't dive into anywhere enough. There's a lot as a practitioner that you can go beyond what we teach for home users. And although the foundations are the same, we know that microcurrent therapy is a very powerful catalyst for neuroplastic healing. And we just don't go into it enough. There's a lot that we can unpack here. When we're energizing neurons, when we're reducing inflammation, when we're synchronizing brain networks, we're doing nothing more than helping the body to heal. Combining this with this intentional movement, with mindset training, with supportive nutrition, and we're making a holistic approach here that can rewire the brain towards a balance of function and wellness. I think it's important to encourage clients to view each session as a lesson for their nervous system. This is an opportunity for their brain to learn how to heal itself. Ultimately, that is the power that we're trying to put forward. So thank you, everyone, for joining me. I'm sure you might have some questions about this, and I'll be happy to answer them. Drop them below. I think it's a fascinating topic that we're just barely scratching the surface of. So take care, everyone. I'll see you in the next video. Bye.